My journey with PET and a ruptured eardrum over the past many years. So sit down, grab, I don't know, cup of coffee, cup of tea, and watch. I've been wanting for a while now to document my journey with PET, Patulous Eustachian tube, which I was diagnosed with officially, I guess, over probably close to 10 years ago, and self-diagnosed with it probably a little bit longer than that. What started as me waking up one day with I could hear myself talking and breathing and not knowing what that was, and initially turning to Google, trying to figure out what it was, and zeroing in on PET, again, Patulous Eustachian tube is what that stands for. And when I first realized what was going on, it was intermittent, I guess, is the best way to put that. It would happen sometimes, and when I would lay down or bend over for whatever reason to pick something up, I noticed that it wasn't there. It would disappear. And when I would lay down and go to sleep, it was gone, or just lay down, I guess to say. When I went to sleep, it was obviously gone. And then I guess the first thing I did was I went to a ENT at a local hospital here, and the doctor didn't even know what it was, which was really interesting. And so I believe I explained to him what it was, and so long ago, so I don't remember all the details of that. I do remember the thing that stands out most to me in that was that he thought that it would help to put a tube in my ear, even though he didn't really know what PET was. And so, obviously, trusting the doctor, I succumbed to his suggestion, and he did put the tube in my ear. And I do remember being wide awake, no anesthesia whatsoever for this tube to be put in, and it hurt like holy hell. My ex-husband, I remember sitting next to me, and I just remember, I think he cringed for me. It was so painful. And then that tube stayed in there for years, and I remember I would go to doctors for other things, other sicknesses, and like all routine doctor's visits, they look in your ear, and I remember them saying to me, you know, you have a tube, and I remember somebody saying it was blue. I just remember it being blue, and they would say, you know, you have a blue tube in your ear, and I would say, oh yeah, an ENT put it in there trying to help with the PET. And then years after that, I, after living with this for years and the tube not helping, and it getting worse over time, coming, going, then coming and staying, I remember I sought out a expert in PET, and I found Dr. Poe in Boston at Boston Children's Hospital. And I remember making an appointment to go up to Boston and see Dr. Poe and meeting with him. We spent the night in Boston and saw him bright and early in the morning, and I met with him, and I remember he confirmed the self-diagnosis of PET through looking into my nose through a scope and showing me that my eustachian tube was indeed different on this side than on the right side, on the left side than different on the right side. And his suggestions at the time, I believe, were the three things that were suggested were to gain weight, which my weight has fluctuated through the years by, I would say, I've been up to 140 and I've been down to about 100. So, you know, it's been all over the place. It's never changed my ear being better or worse. The other thing was to stop drinking caffeine. Same thing. I've drank a ton of caffeine, cups and cups of coffee a day, and I've had what I am now, which is about 1 cup of coffee a day, and that has never changed either. And the third thing was to, I believe it was to stop taking birth control pills, which I believe at the time of this diagnosis, I was, gosh, we're going back to, I'm 50 now. So this was, I think I was just about to turn 40, excuse me, somewhere around there. And I believe my doctor had just recently taken me off birth control. None of those things had ever changed whether my PET is present or not present. So, see, we cut to the year. I'd have to double check on the year, but I was driving to a girlfriend's house one day, and all of a sudden I felt this really, really, really horrific pain in my left ear. And this was the first time this had ever happened. Pressure, pain, like a screwdriver being jammed into my ear, and all of a sudden pus came out of my ear. It was horrific and gross. And I believe from that point forward, and I want to say that was somewhere around somewhere between 2015 and 2017, somewhere around there. I want to say from that point forward, I started to experience hearing loss in my left ear. So, and that has just gotten gradually worse. And, whew, trying to remember. After that, I want to say, now knowing what I know, that was a ear infection. And after that, I would also like to say that that tube that had been present at all of my doctor visits was now not present. So somehow it must have, my eardrum, I believe, now again, knowing what I know, my eardrum must have ruptured. The tube somehow fell out. It's teeny tiny, so it's not like we could go looking for it. And I believe that that was my first ear infection. And after that, in addition to starting to experience hearing loss, I started having ear infections, pretty bad ear infections. I could probably also say that from that point forward, my sinus infections got more pronounced and much more evident and bad. So, um, hmm. I believe that the next incident was when we went to Vegas, or the next big incident was when we went to Vegas in October of this past year, and we were just starting to take off, I believe, and I started experiencing that same horrible pain in my ear, and just excruciating, like you feel like somebody's jamming something in your ear and you have no control over it. And I don't think my ear started to drain on the flight, but I do remember being in Vegas, and for what was about 2 weeks, my ear drained. And so I knew, and I felt really shitty, actually, if I'm being, if I'm remembering correctly. It drained, and I felt really shitty for about 3 months. October, November, and December, I felt awful. So I knew it was time to really do something. I actually tried to call Dr. Poe and try to get up to see him again to find out what I could do to not have to live with this any longer. And they told me that because I have a ruptured eardrum, that the ruptured eardrum has to be dealt with before anyone can even deal with, again, my PET. So what I have going on now is a couple different issues. So initially the diagnosis was PET, Patulous Eustachian tube, which is where the eustachian tube, I believe, if I'm understanding it all correctly, the eustachian tube remains open all the time. That's that aural open feeling that we who have PET get. So we hear ourselves talking and breathing all the time. It's maddening, especially when you're somebody like me who talks all day to patients, and you can't really avoid it. But so that was my original diagnosis. And then somewhere along the line, my eardrum ruptured. And so now I have a hole. It's not a huge hole, but I do have a hole in my eardrum. And what happens is infection, or I should say bacteria, through everyday life, through showering, water gets in, being in a pool, water gets in, though I do wear earplugs. Whatever life brings us just through daily living, bacteria gets in your ear, and that bacteria creates infection. And through that infection, not only does it infect my ear, but it can also travel to my sinuses. And if you really want to read and freak yourself out, that ear bacteria can eventually, if not treated and not taken care of, lead to bacteria that can go to your brain. And so I started thinking about this and really freaking myself out. And that's when my husband and I were like, okay, time to really do something about this, because that's really scary. So so after I found out from Dr. Poe's office that they will not see me until I get the hole in my eardrum fixed, we looked into seeing a doctor. He's an ENT, but he only deals with the ear. And so we found a doctor down at Penn, and we went and saw him. And so I am now scheduled for surgery September 27th. And what they will do is go in and they will patch up the hole in my ear. And if they have to, there may be little teeny tiny bones, smallest bones in our body or in our ear, and they may have to go in and fix those tiny bones in my ear. And he said that whatever else needs to be done while he's in there, he'll do. In the meantime, right now, today, I am home from work early because I feel horrible. I feel, I have the chills, I have the sweats, I'm nauseous, I feel like I have either an ear infection or a sinus infection. I'm not 100% sure what. I can hear myself talking right now, which I want to scream. And I can hear myself breathing. So there's something going on. There's an event going on in my ear right now that is driving me crazy. So I don't know if I have an ear infection or a sinus infection or a something infection, but I feel awful. So I did come home from work early. So this is all part of living with this. It's just, it's constant, it's day to day. You don't know how you're gonna feel day to day. I could feel amazing tomorrow. But this is just how I live with it. It changes day to day. Sorry. But it's, I'm hopeful, sorry. I'm hopeful that the ear surgery will be successful and it will at least close, no pun intended, it will at least close that one chapter. Sorry. Hopeful that it will at least close that one chapter of this whole ordeal. And then I still have the PET to deal with. And yeah. So I will keep you posted as I go through the journey, which changes daily, depending on the day, depending on the weather. I also find if anybody else out there is dealing with PET and this whole issue and sinuses and ear infections and just the whole head bullshit, it really is also, I believe, weather dependent and humidity dependent and barometric pressure dependent and all of that stuff. So I'm gonna post this on YouTube and maybe we can all kind of help each other. And you can join my journey as I start to finally fix it and get answers and go through the surgery, which I'm scared to death of, although I know I have to do it. But anyway, I hope this finds you well, and if it doesn't, I hope you reach out and we can help each other. Thank you and have a great day.